Welcome to Pep Talks, a patient experience podcast where we share stories of promise, our culture of connection and care. In this episode, you'll hear from Greg Feldman, one of our pancreatic cancer survivors, and his medical provider, physician assistant Tiffany Valone. Greg and Tiffany share with us their insights into how their 9-year relationship, built on trust and care, provided the support Greg needed to sustain him throughout his long cancer journey. The challenge for our cancer patients is not only the physical effects of the treatment, it's also the emotional impact of the cancer experience. When our patients know that we see them, hear them, and are always there for them, respecting all of their needs, then this results in a connected, trusting relationship that lessens the burden of cancer on our patients and their families.
My name's Greg Feldman, and I was diagnosed with pancreatic cancer in February of 2012.
I'm Tiffany Valone. I'm a physician assistant in the GI department. I've had the privilege and honor to work at Moffitt for the last 16 years.
I was a big strapping physical man that worked out regularly, and I thought I was Superman, and cancer proved to be my kryptonite. At 168 pounds, from 265 pounds, I was a different person. I was so weak that my 120-pound wife had to open my water bottles at that point. Along with the physical side, the mental side, to be honest, was tougher. It was dark. It was the toughest thing I've ever done, and I'm not afraid to say that to other patients that I've talked to, because I kind of feel like you need to know that you're most likely going to have these issues when you go through your cancer treatment. With
my patients, I try to treat the whole patient, and that's including, I tell them how important not only is the physical aspect, working in medical oncology, so getting them through the side effects of the chemotherapy, but also the emotional and kind of psychiatric component of it. And as Greg alluded to, that is a very big component for patients' cancer journey, is the emotional aspect, and how are they dealing and coping with their whole illness.
I always prided myself on being, a strong individual. I would go walking in my neighborhood, and I knew that if I walked a quarter mile away from the house, that meant a half a mile total for the day. And, just the phone in my back pocket. There was sometimes I'd have to sit under a shady spot on my journey around the neighborhood and just sit down and wait for a few minutes till I got some more energy. And I was out that day, and I didn't know what was going on. All I know is I felt like my heart was coming out of my chest. I mean, I was in full panic mode, and I dialed Moffitt, and they answered. I was glad that they answered, because I needed a life preserver. And that's when I found out through Tiffany Valone about the help that was available across the street. I was a little embarrassed to go in there. I don't know, I think it was more of the culture that I was raised in. I remember talking to the psychiatrist, which, sharing your feelings, although it was extremely necessary, it wasn't something that I was used to. They provided the help that I needed to get through that point, and it was unexpected for me, but I don't believe it was unexpected for the professionals that were treating me.
So I will tell patients, a lot of times it may take, several attempts, but if I can sense in our visits some anxiety or perhaps some depressive symptoms, let them know that we do have those services available here at Moffitt. And I go into detail letting them know that it doesn't have to be medication management. We have great psychologists that can deal with meditation techniques, coping strategies, etc. And it doesn't hurt to just have that initial evaluation in their department. So I tried to get that referral going pretty early on in their cancer journey. But for some patients, it does kind of take that, again, trust and rapport over time of seeing them and meeting with them and bringing it up a couple times before they'll accept that referral.
Tiffany Valone was the one constant that I've had for 9.5 years. I've been here so many times and sat there waiting for her to come in to give me results from scans. You tend to be a little bit of a poker player, because from the minute they open the door to come in, you're trying to read them. If they've got bad news to relay to you, I ought to be able to see it in their face when they come in the room. But, I could never tell. She would, talk to me concisely. If you're facing something that's very serious, there's nothing flowery about her approach, which I appreciated, because it's so hard to disseminate all the information that you're receiving anyhow, that the more clear and concise it is, the more you appreciate it.
I would describe my communication style as direct and honest, but empathetic and optimistic. I would like to think that I encourage my patients. I definitely want them to be educated and informed about their care. I try to tailor the approach with each patient, as that might vary with their levels of education and the individual backgrounds.
She addressed both myself as the patient and my wife also, who was always there to, ask the questions that, maybe I was missing. But, I just developed a really good rapport with her. When you have somebody like that, that's always there when you are there, then it gives you a comfort, It's not so much like you're in a revolving door.
When I'm meeting patients for the first time, I try to get to know them on a personal level before I dive into discussing their cancer diagnosis. I may ask them where they're from, or for them to tell me a little bit about their family or perhaps their job. I then like to review with them what I know so far about their cancer diagnosis. I feel that this helps them to understand that I've studied their case, and gives them an opportunity to give me any additional information that I may not have gone over, or ask any questions up front that they may need to clarify to have a better understanding of why they are seeing me. I believe over time this develops good trust and rapport with my patients. For some patients like Greg, who I've had the honor to treat for years, our visits will also be social visits. We'll talk about his health and cancer status at first, and then we'll talk about his family or maybe some upcoming trips that they have planned. Greg was a superstar. He was determined to persevere through his treatments. His wife, Melissa, was by his side every step of the way. He achieved a huge milestone this past year when he hit 9 years from his initial surgery and rang the bell in the GI clinic.
My last scan was back in July. It was the typical scan. You're nervous, even if you feel good, because you're apprehensive about what they might find. And so at the end of her giving me a good prognosis on my scan, she said, I need you to go ring the bell. We're at that stage of your treatment. And so I wandered down the hall, and there's a little brass bell on the wall, and I rang it, and the building erupted. There were people cheering. Behind closed doors, it raised the hair on the back of my neck. And so I rang it a little bit longer, because I was enjoying this attention. And so that was quite the moment that we had that day.
We asked Greg if he had something to say directly to our team members.
I just would like them to know how much I appreciated the teamwork that I saw. I mean, I felt like at Moffitt, everyone did their job, from the surgeons to the nurses to the people that were volunteering, janitors. I just felt like everybody was working towards the goal of healing patients. And I feel indebted to Moffitt. They saved my life.
Thanks so much for listening. We hope you'll join us for our next episode of Pep Talks. Until then, keep living the promise.